Hello everybody, I'm Dr. Mohan Puttaswamy. I'm a senior consultant orthopedic surgeon and joint replacement surgeon here at Fortis Hospital, Bannerghatta Road. I'm associated with Fortis Hospital for the last decade since I've come back from US. So in joint replacement surgery, there's been tremendous advancements over the last couple of decades, and the whole specialty itself is young, say in the last 40-50 years. But we are at the cusp of a situation where we are really reaching the end of the easy pickings. If we take knee replacement, which is the largest joint replacement which is done across the world, the satisfaction rates we have achieved is about 80 to 85%, and about 10 to 15% of our patients are not happy. So the biggest challenge for any joint replacement surgeon or any joint replacement center is to improve this satisfaction rates. Across the world, tremendous amount of energy is being put into changing this number, and the early success happens in arithmetic proportion, but this is where our endeavor as a joint replacement surgeon is to improve the satisfaction rates. Now the example I give all my patients is to run at less than 10 seconds 100 meter. For mankind it took hundreds of years, and it happened in 1968, and from then on milliseconds are being cut off. So similarly, the excellence and success in joint replacement surgery is happening in increments. Now why I mention this is, there's a big concern regarding cost in joint replacement surgery and new technology platforms which we are introducing. Recently we have bought a robo through which we do a knee replacement surgery. Now these are all extremely expensive equipments, and the reason we are deploying these techniques and technology is to make sure that we have good success. Now the outcomes will be seen down the road, but right now, most of the endeavors which is happening in our specialty is to make sure the satisfaction rates are higher, the complication rates are lower, and the longevity of the implant and the patient is excellent. Now, towards these things, here Fortis Hospital, Bannerghatta Road has provided an excellent platform. As one of the largest joint replacement centers in the country, we are able to deliver excellent care to our patients by deploying everything available. So at least in my practice, I use something called health optimization protocol, where we correct the patient's pre-existing conditions, thereby reducing complications. We use the technology available anywhere else in the world, the best in the world, something like the advanced robotics, so that again our patients get benefit out of it. And the endeavor is to ensure that our patients get the best outcomes with the lowest complication rates. And this is a challenge which is happening across the world. And even in our endeavor as a group, we are trying to achieve the same. So using all the advanced protocols, standard operating procedures for our knee and hip replacement patients, excellent physiotherapy, fantastic anesthesia team, and obviously good surgeons, we are trying to change that rate of satisfaction, trying to improve them consistently and trying to reduce the complication rate. So the difference between any regular center and an advanced center is that in an advanced center, you have the tools and means to ensure that the success is higher. And happy to share that ours is one of the best in doing the same.